Hello, everybody, and welcome, Dr. Lori. Thank you so much for joining us today. Dr. Lori is a naturopathic doctor and a colleague of mine with a clinical focus in cancer care. And she incorporates fasting with a lot of her patients as well. So I'm really excited to pick your brain over the next 20, 30 minutes, ask you questions about how we can utilize this amazing tool to prevent as well as improve or as an adjunct therapy with cancer treatment. So thank you so much for joining. And I want to dive right in because I know we've got busy schedules here. Can you tell me about why fasting is so important for cancer prevention or patients going through traditional cancer treatments?
Sure. Yeah. So thank you for having me. And hi, everybody. When you said I use it for some patients, I actually incorporate fasting protocols for every patient, and every protocol will look a little bit different. And what I think a lot of us fail to realize is that we all fast overnight. So unless you're getting up at like 3 in the morning and eating, most people are doing at least a 10-hour fast, an 8-hour fast overnight, right? So it's not a concept to the body that's really new. It's now looking at the statistics, looking at the studies, looking at how even more prolonged fasting and lowering our calorie intake can benefit our system in many ways. So your question, let's start. Sorry, what was your question about how it can benefit for cancer care?
Yeah, is it about just reducing growth factors? Is it about reducing the inflammation? Does insulin play a role? Like, what different physiological benefits are you getting from fasting that is associated with the prevention of the development of cancer?
Yeah, so you think about every time that you're eating something, your pancreas is releasing insulin to help get the glucose into the cell or get to the sugar into the cell. And so every time that you're eating a meal, glucose is being spiked and insulin is being spiked. Knowing that insulin is a growth factor, that is exactly what we want to limit in a cancering situation. So if you think about as a child, when you're young, you want that growth factor to be high, you want to be more anabolic, you want growth. But as an adult, we actually don't want that excess proliferation and we want to control the cell metabolism. So overeating and having that insulin being spiked too often can actually be a huge problem. And then also when it comes to controlling inflammation as well. So we know that too many calories and along with sedentary lifestyle, other chemicals, other things that our body is exposed to, way too much stress. So just lowering how many calories you're having in a day can have a huge role in lowering your cancer risk.
Now, the other thing that we have talked about in the group is the benefits of longer fasting in terms of autophagy. And there was a question that says, okay, if we use this prolonged fast to incorporate or enhance cellular housekeeping, we're breaking down cells that aren't behaving as well. The question was, well, do those cells come back? And absolutely, they can come back. And I think in some of your videos, you've talked about how everybody has issues with their DNA at some point in time. And it's about the immune system being able to recognize that and repair it. Or we all have cancer cells in our bodies. Is that right?
We all have cancer cells, every single one of us. And there's that big misconception of, is it genetic? And that used to be like the somatic theory to cancer, thinking like only if my mom had it or grandma had it, like I'm going to get it. There's actually more of an epigenetic component more than anything. So a lot of us have tumor suppressor genes that are mutated. And so you're more likely. So we know that as like the BRCA1, BRCA2, check inhibitors. There's a lot of things that really affect how your body cleans up. So what you're doing with fasting and getting into autophagy is your own body's cellular repair. So it's enhancing how it's kind of recognizing those mutated cells and helping to clean up. So we all go through autophagy, but every hour in a prolonged fast, you're actually enhancing the effects. So they say in the studies that 72 hours of just a water fast is when you get max autophagy. Everyone is so different when it comes to how their cells are responding, but think of it as like an innate cleanup that, when you do house cleaning in your home or when you're cleaning out your fridge, you're getting rid of the old stuff that may be moldy or just should not be there and replacing with new food, new things in your system. Same thing with your body. So it's like the best way to reset, clean up what shouldn't be there, and then help your body repair and regenerate.
And if you're committed to doing either a 72-hour water fast or the 5-day fasting mimicking diet, What can you do either before or during diet, lifestyle, supplement, whatever it is, to get into that max autophagy speed? Or how can we get into the burning fat for fuel or getting into ketosis faster? Is there some things that you can do along the way?
Yeah, and this is things I wish I knew when I was younger. My mom used to throw me into these fasts, and I would just like do the experiment when I was like like very different reasons why I did it when I was younger. And I had no idea the science behind it or what I was doing. And so I jump into it. I did the master cleanse. It was like just all wrong, like 10 days of just lemon and cayenne. And anyways, there's no prep. I literally just like jumped into this. I felt disgusting. I feel like I was depressed the whole time. I was so tired, so grumpy. I ended up cheating and eating an orange at like in the middle of the night. Like it was just like all wrong. So if I was to like talk to my 12-year-old self of how I could prep better for that, you want to get rid of the high carbohydrate, really minimize your carb load leading into this 5-day fast. If you think about our body has basically two main ways of producing energy, the glucose or from ketones, right? So, or from fats. So if you're like glucose, sugar, carbs, and pastas and
Ice
bread,
cream before a fast.
all those like really fun things that you just think of like, oh, I need more energy. I'm going to have this quick, like, whatever is right there. That is going to make your life very challenging to go into a fast. So it's almost like you need to slowly wean off of those carbs or just cut down drastically. And your body is so smart, it'll start using fat for energy. And that's how ketones are made, from this fat source. And so if we can start to train our body to go into that, becoming more metabolically flexible, by the time you initiate a fast, you're already primed for that, and you won't have those huge energy dips or feel depressed or feel like you need to have a sugar fix and all those things that I didn't know before. So your body is that intelligent where it can say, oh, there's no sugar here. I can start using my fuel or using my fat for fuel.
And one of the things I also find helpful, it's like that transition phase for me, like the transition from depleting the glycogen and the sugars and burning sugars. The switch into ketosis or burning fat for fuel is the hardest part for me. So if I can get through that quicker, and one of the things I do is just like a little bit of exercise, a little bit of burst training or a little bit of weights, get the glycogen down a little bit more. I have a
Yeah.
much easier time transitioning.
That's a good idea. And another really important thing too, because I see a lot of people who are like, their diet is pristine and it's really like low glucose and they eat really well, all the things, but they're super stressed. So you don't
Mm,
want to pick a time to fast or when you're feeling like you're completely overwhelmed. Because when you're in this fight or flight mode, high cortisol and high stress, your liver is going to start producing more glucose through gluconeogenesis. And so your glucose can actually be high in the bloodstream. And that's again creating more stress on the pancreas, more insulin spikes. So
mhm.
that is a big part of preparing, making sure mentally you're saying, okay, everybody, like this is what I'm doing. I don't want to be go, maybe going to bed earlier so you also don't have those temptations, and just
Mhm.
feeling like you can rest and relax, give yourself that permission. Fasting is a time when you should be able to repair on all levels. So maybe more journaling or, just reading, just taking it easy. So not feeling like you have to be in that go mode.
So, and I even find like sleep is so important for me. Like my daughter woke me up day 2 in the middle of the night and I was like, no, I'm gonna be so hungry.
Yeah, that's the thing, right? It's huge. You know that if it's like 2 hours different, your cravings are just your glucose is all over the place. So, yeah, that's a huge part. Getting to bed early, if you have to take, there's certain supplements that are fine to take while you're fasting. I don't know if you talk about that in this program, but there's a lot of things that are water soluble that will not spike your glucose or your insulin. It's very beneficial, actually.
Things that you can do to help get you to sleep if you're trying to get to sleep a little bit earlier.
Yeah, or if you're stressed or, if there's things that if you're feeling lightheaded or if there's anything going on, there's things you can do to support your
Mhm.
body.
Now, what if you get to day 2 to day 3, and then all of a sudden you're like, oh my goodness, I don't feel well. What are some troubleshooting things that you can do?
Yeah, I don't know if everyone who's listening has a glucose monitor, but I
Mhm.
highly recommend checking to see what your glucose is because you genuinely could have really low glucose, right? And that may not be something that you're suitable, like you're not going into ketosis possibly, like if you're not producing ketones enough and you just feel like really crappy.
Mhm.
And that's usually when you're not leading into the fast properly, like you're just kind of cutting off all sugars and then you tend to go more hypoglycemic.
Mhm.
So electrolytes are a really great way to put into the fast. So just to help, sometimes it is just an electrolyte balance. I'm a huge
Yeah.
fan of Epsom salt baths,
Mhm.
just getting magnesium in that way, lots of water, lots of teas, like just not dehydrating ones, like trying to do more herbal teas. And like I said too, just taking it easy. On day 2 or 3 is usually when, if you have any blood sugar issues, where it starts to kind of convert more and your system
Mhm.
starts to adapt more. So you could try to just like stick it out, especially with the fasting mimicking, right? You are getting some fuel, so you're probably not complete.
Extremely low or deficient.
Yeah, so it's probably not the glucose that's the issue. It's could
Mhm.
just be on a lower calorie. If you're outputting too much, you could feel awful. So taking a step back and saying like, do I need to do these 30 things on my to-do list, or can I just
Yeah.
relax, right, and hydrate?
Or how busy are you? Things like that.
Yeah, getting enough water. I also find MCT oil is really great during a 5-day fast or fasting
Mhm.
mimicking. For some people, it actually really helps spike their ketone levels. So it'll help with cleaning up, helping with ketone production. So that's something you can try, but some people it spikes their glucose too much. So it's really an individualized thing. Getting enough
Where
fat
you
is really, really
where you
important.
could add, you know, and even individuals that are listening, if this is your first round of the fasting mimicking program and you want to try it again next month, you could use a continuous blood sugar monitor as a tool to try to pinpoint and navigate how does your body respond to exercise? How does it respond to stressors? How does it respond, you know, the couple days before when you're lowering those carbohydrates before entering the fast as well. So there's lots you can do from a troubleshooting perspective.
Exactly. And I love that you said like you're holding these every month, because for weight loss, that's exactly what I do with people. Fasting mimicking 5-day plan every single month until you get your goal weight. And then I'll say like every 3 months, do a plan like this, because then
Mhm.
you're actually just resetting the system. For cancer, I tend to do more around chemotherapy or around drugs because you respond a lot better and your cells are more receptive without damaging excess damage to your healthy cells. It has more of a protective effect. So we would do 48 hours before their chemo and then 24 hours afterwards. So that's kind of like what the study, the gold standard. But any type of fasting mimicking plan is really beneficial, even to prevent drug resistance too. So you see that a lot where someone's like, I'm not responding to this medication anymore. I have to switch this drug or I have to do this. So by lowering inflammation and doing these fasting protocols, you actually respond better if you need these conventional therapies.
And I really like that you've paired strategic fasting in and around the chemotherapy treatments, because it used to be that we were really worried about weight loss with cancer and we didn't want to lose too much muscle mass. And some of the recommendations that I've seen is just eat whatever you want and eat high calories. And really, when we look at the research, that to me really doesn't make sense in a patient who has cancer. And the nice part about the 5-day fasting mimicking program is it actually doesn't seem to reduce lean muscle mass that much from what I've seen in terms of the studies. It actually doesn't impact the lean muscle mass if just done for those short duration.
Yeah, and you want to also not be doing these massive hit trainings on day 3, 4, and 5. Like that's when you start to lose muscle, is when you're putting your body through this test and you need the aminos and the protein to help build up. But yeah, you like in a 5-day, especially in a 5-day mimicking, no, that doesn't happen. And when in cancer, when someone's cachexic and they are losing too much weight, the problem is actually inflammation. So it has nothing to do with calories. And I'm sure everyone listening to this, if they know someone who's cachexic, they could eat like 5,000 calories and not gain weight, right? So we know the problem is not calorie intake and how much you're expending your energy, because most people are in pain and tired, but fasting is one of the best ways to bring down ESR, high sensitivity CRP. It brings down all of those inflammatory markers and people can start
Mhm.
absorbing food better when they do start eating again. So I don't have any fear with fasting in cancer. And actually in Europe, the hospitals there, that's like standard protocol. When someone is coming in for hyperthermia or for even chemotherapies, everybody is fasting. So
Yeah.
here, very behind and eat whatever you want, just don't lose weight. It's like, No, don't just eat whatever you want. That is so opposite of what you should do.
Yeah, especially when it comes to those inflammatory proteins, which is just so much of an issue for so many people. Now,
Exactly.
one of the questions that also came up is, are ketones harmful? Right? So is there a particular level of ketone where it's too much, or is it harmful?
So if you're supplementing or your body is creating it, right? Because if someone is higher glucose, for example, and they're going into ketoacidosis, that is quite harmful. So if you're not supplementing and this is your own body doing this, no, it's not a problem. Every time that you're helping your immune system and bringing down glucose and helping just kind of reset and using ketones, it's a really great thing. The only time it would be a problem is if you don't have regulated blood sugar, but it's very hard for your body to make these ketones if your glucose is high. So your
And the
body,
exception would be like a type 1 diabetic patient,
yes, exactly. Yeah.
where
So
we would
that's,
want to be a little bit more cautious.
yes, exactly. Yeah.
We talked about how to prep for the fast, troubleshooting in the fast. How do you transition your patients out of the fasting, either when they're doing chemotherapy or if they're doing fasting for weight loss?
Yeah. So the worst thing that you could do is go for
Pizza, ice cream.
all the carbs. You think about like all of your insulin receptors have down regulated and they're like, okay, good. I don't need to, right? And so if you start like blasting the body with pancakes, not the healthy ones that we would be promoting, like just the ones that are all sugary and juices. And so you don't want to break the fast, even with healthier fruits, right? Like just any sugars where you're causing more of an insulin spike. So you want to focus more on proteins, more on healthy fats. And even with vegetables, you want to steam them. I mean, with the fasting mimicking, it's different than just doing a 5-day water fast. You've already been eating really healthy and clean throughout the 5 days. So you don't have to be as much of like a 2-day transition diet. You can even go into having more protein, more salad, just like the same foods, but at a higher quantity.
Kind of like easier to digest things, especially if you've been overall really low calories or low food in general, or maybe you've just done a water fast. Really incorporating things that are easy to digest, like soups, things that are just more resting on the nerve or resting on the GI tract.
Exactly. And even the things that are like with high in lectins, like you may want to avoid things like chickpeas and beans and things that are just harder for the gut to break down unless you really like soak them for a few days and pressure cook them and do all that. But that could even cause a lot of gas. So if someone just jumps into having these harder to digest foods, you're not going to feel great. You're not going to have those enzymes activated. So but like I said, like everyone in this is they're eating every day, so you don't have to transition the same way. I know for me, I find fasting mimicking is very challenging, so I think it's amazing that you have this group and to support everyone because I'm such an all or nothing person where it's like I'd rather just avoid everything for the 5 days versus like teased with things. But if you're working, if you have a lot of activities that you're doing, this is actually the best plan to be doing while still trying to have a life and a lifestyle going on.
Outside of it. It was
Yeah.
really interesting. This was my first time participating in the fasting mimicking. I've done longer 3-day water fasts, and I was curious to see like how I would react. So my initial plan was I'm just going to eat all of the food all at once, because then I'm like, I already fast, and then I get like at least an okay amount size of food. But then I found, no, I'm actually doing much better in terms of my blood sugar, spacing it out even more, which I found interesting. And I'm wondering if it's perhaps just the amount of go, 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 or the movement, like maybe next time scheduling it at a time where there's not as much running around to do. Cause I was like, I was not feeling good there for a little bit.
Yeah, and it's such a mind game doing this fasting mimicking and fasting in general. It's more mentally challenging. So in those 5 days, taking the priority off of food, right? So just having that small meal and keep going on with what you're doing, you save so much time. You realize that you have time to do all these other things. And how amazing is that? I find it's even kind of like a spiritual detox too, where I just kind of sit with my thoughts a little bit more and I have a lot more energy. I feel just a lot more empowered. So I think all around it's really great for people to do, but it has to be, like you set up your lifestyle around it where it's like, this is what I'm doing. And
Mhm.
yeah,
I've like delegated dinners to my girlfriend. I'm like, the kids are gonna come over and they're gonna eat the food. Here it is. And I'm gonna have my time, which has been really great. I know it's not always feasible for individuals to do that, and I'm very lucky, but it's like fend for yourself in my house unless you want avocado with salt.
I love it. I love it. Yeah, and that is like dealing with families' impression. Because I've even like my kids are like, are you like, what's wrong with like why? Like it's so confusing to a young child. Like, why is mommy not eating? And like, why is that right? But when you say to your children, like, we're cleaning up, and a lot of religions actually incorporate fasting, right? So it's just like a
Mhm.
normal thing that they do part of the religion. And so for us to incorporate it, it's the same thing. We're almost just resetting. And I think it should be part of everyone's lifestyle and it should be normalized. But yeah, explaining to family members who just don't understand it or young kids, it can be kind of confusing.
A little
So
bit challenging. Yeah, and the last thing I want to lead off of, and thank you so much for joining and sharing your expertise. I really appreciate it. It's about a learning experience. So it doesn't have to be perfect over the 5 days. Take what you've learned from the 5-day fasting mimicking and apply it to the next one. Maybe you're looking at, okay, this didn't work for me then. I can repeat it again the other time. And for some, maybe the longer prolonged fasts are not the best fasting routines, and looking at more of the shorter duration intermittent fasting or 5 to 2 or periodic OMAD could be helpful. It doesn't have to be 100% perfect. It's more of a learning experience for each person. But I love the
I
tip with the glucose meters.
Yeah, I was gonna say I love that comment because it always everything that we do in health, it's never a one size fits all. So some people they'll do a 2-day water fast, like just 48 hours, and then do 3 days of fasting mimicking. So you can switch it up and you can see how you feel the best. Some people, their ketones after 24 hours are through the roof and they're feeling really good. And so they may not need to do full 5 days. They can maybe get the same benefits in 36 hours or 72 hours. So I love that you hold these groups and everyone like keep people accountable, get excited for doing this and have the resources to be able to troubleshoot what's going on. And I think it is
Mhm.
something, even if you vary, like you make it a little bit different every time you do it, it's still you're learning about your body and how to improve it every single month. I love it.
Oh, thank you. Last question, because you've mentioned ketones a couple times. What is your favorite way to measure ketones? Device,
Yeah, so you don't want to do anything besides blood. So
blood.
if you're doing a breath test, yeah, there's a lot of false positives with that. With urine testing, it doesn't measure, it just says yes or no. And
Okay,
also, yeah, so blood would be the way to go.
the blood. Do you have a specific home meter or brand that you like?
Yeah, I go through Keto Mojo in the States. Keto Mojo, yeah, that one's amazing because it also checks the glucose.
Oh,
If
nice.
you're from Canada, I use Flora or Fora, Fora.
Okay.
They're
I'll
both.
get that information for you and post it in the comments too. That's great. I've actually only monitored my glucose with like a CGM, but I'm definitely interested in having a look at how my body responds to ketones too as we go through this process.
Yeah, and if you look online, so Keto Mojo is a really great company that they have tons of resources as well, and they have the calculator. So the
Mhm.
whole point, especially with any inflammatory condition, whether it's being overweight, diabetes, cancer, anything, they look at the ranges. You have to put in this calculator what your glucose is, what your ketones are. And for ultimate, the best type of cancer care, you want to be in a high therapeutic range of ketosis. So you can
Okay.
be in the moderate or low ketosis, like even after 16 hours, someone could be in like the low level of
Mhm.
ketosis. But that's the really fun and exciting part of measuring. So you can see like, okay, next month, let's see if we can get into this higher therapeutic range.
Amazing. Oh, another fun tool experiment that now I need to buy and invest in.
Our
All
lives.
right.
Oh, geez.
Thank you so much. I appreciate you coming on. I will also include links to Dr. Lori's Instagram, social media, and website as well for anyone who's interested in getting a hold of you or contacting you for one-on-one care. Thank you. I really appreciate it.
Awesome. Thank
Bye
you.
now.